Dr. Pacheco Werner and Huron Mayor Ray Leon will discuss rural public health as part of the revamping and reevaluation of public health in local communities. So Dr. Tanya Pacheco Werner is our first speaker, is the co-assistant director of CSU Fresno Central Valley Health Policy Institute, CVHPI. She's also a primary partner of the Fresno COVID-19 Equity Project. Welcome, Dr. Pacheco Werner.
Thank you so much, everyone. I am so excited to be here with you. I'm excited that I just got to follow all of these amazing presentations, because I truly feel like what we are doing, it ends up being kind of like a summary, right? We were hearing all of these things very, very early on. For me, I'm part of Fresno State, and I'm also, at the Central Valley Health Policy Institute. What we do is we kind of end up being the translators between systems and community. And so during the early on in the pandemic, we were engaged with our community-based organization partners, and we were hearing about the need to really spread more information to particularly our immigrant and refugee populations within Fresno County. And so we immediately responded by launching a COVID-19 weekly call, which was at that time kind of translating everything that community-based organizations were getting on a call on Thursday, and giving that same information to the population on Friday, because we know that our folks need information, they need it live, and they can really understand it when it comes from trusted partners in a way that they can understand, and in a way that really addresses what they really care about. And so I'm so excited to be able to talk to you all today about a little bit of what we did and who we are, and know that there's like so many more organizations than this working on what's called the COVID-19 Equity Project. But this is not work for the weak, right? And not just the weak, but just like, it took a lot of resilience to get to what we are launching right now, which is community health workers, culturally adapted training, coordinated activities with the county and city officials, wide range of coverage in rural areas. So pretty much the summary of all of the issues and points of concern that my previous colleagues were pointing out. We also were seeing those on the ground, and really sought to create a response that was really going to try to address this as a community-centered approach that would be powered by community and for community. And so let me tell you that while I am one of the people that co-wrote this scope of work, that actually garnered upwards of almost $10 million in CARES Act funding to do the work, I did not come up with these ideas on my own. I came up with them by being engaged with our community partners and our community leaders, who would be texting me and telling me, simple things like, Dr. Pacheco, I'm getting, a mom reached out to me and she says that she needs a test for her and her kids, but she doesn't know where to get one. Or my neighbor is being told that she has to go back to work, but she doesn't know when she actually is safe to go back to work. Do you know? Right? So all of these things are things that people in the community were telling us and concerns, and that's how we kind of wrote this proposal in terms of what we do. So working with community-based organizations is really key for us, because you really need to be able to have people that not only speak the language, but know the people, know the neighborhoods, to know what the how this is going to work best. And so to show you a little bit about the three components of what we're doing. So we have health education, curriculum, and adaptation. So just like our amazing partners at Bakersfield College, we really saw the need for actually training community-based contact tracers. And these are really people that we're training with all kinds of educational backgrounds. Some have high school diplomas, some have college, but some don't have any of those, right? And we're training them all. And so really adapting what the trainings are that are available out there on a national level, and bringing them down in language that people can understand. In order to get those contacts, right? It's not just notifying somebody, as the doctor so well said, it's not just contacting somebody and notifying them that they are positive, but it's helping them understand that it's really important to let others that they were in contact with know that they are positive. And it's also about those efforts to connect them with food resources, financial assistance, mental health, right? All of these things that we see are so important. So one of the things that I wanted to note is that direct quarantine supports is such a key lever to what we have to do as part of our work, because the number one reason that we know why the people that we work with, why they don't get a test to even know if they're positive or not, is because of that fear of missing out on pay, right? So that lack of knowledge that of what are the resources that are out there. And then also, once they are positive and somebody tells them you can't go to work for 14 days and people don't have benefits at their work, their day-to-day labor, right? All kinds of employment circumstances, not like me that I get my regular, check stub that shows me how many, sick days I've got, how many vacation days I've got. That is not the reality that the community that we work with is living in. And so providing that direct quarantine support is so, so important. And not only providing it just by like having them call a hotline, because we learn from other quarantine supports, not quarantine supports, but other funds that have been made available, is that people don't really know how to navigate, how to access funds very clear. They're already stressed trying to figure out online learning, trying to figure out just a million new things, and then trying to figure out how to send documentation through an email or a phone number, right? All of those things become a challenge. So it's really direct quarantine supports, but with that community health worker promotora model of somebody really walking them through. I just wanted to say that it's important that for us, it was important for us when planning this, that we made sure that we knew where each organization was going to be, so that we knew we had adequate coverage based on the data of where the most cases are. And so my team at CVHPA, we're actually looking at the cases. We are seeing where the hotspots are, and we are working with our county, city, and CBO partners to make sure that they get testing there, and they get health and education there. And this is really a broader network that's not only for immigrant and refugee population, but we knew that but there's an African American coalition as well that's doing this work, and that we at CVHPI are also training in all of this work. So we're really doing cross training, always recognizing that each population is unique, and that and so those organizations do their own supplemental training about knowing how to address their own communities, and we provide that overall training on how to do community health work, how to do contact tracing, how to understand COVID and talk about it with others. And we also work with health partners as well as the hospital systems, federally qualified health systems. Everyone is really integral in making sure that we really address the pandemic from that testing, quarantine, isolation, mitigation strategies, but from a community-based lens. And so this is what we're doing, and we've just launched this. We're working with clinics now. We're setting up testing events. We're just wrapping up our first cohort of 30 community health workers training tomorrow, and we're launching more next week. And one additional thing I want to say about this is that we're actually also partnering with the statewide network of promotoras called Visión y Compromiso, so that the community health workers that go with us also have the opportunity to become part of the statewide network of community health worker promotoras and have access to all of those resources, because we really see that this isn't just a workforce to respond to the pandemic. This is how we need to reshape public health. So thank you.
Thank you, Tanya. That's such exciting work, and we can't wait to hear more about it. So now I would like to introduce Mayor Ray Leon of Huron, California. He is the founder and executive director of the San Joaquin Valley Latino Environmental Advancement and Policy, also known as the Valley LEAP project, that is soon to incorporate as the LEAP Institute. Welcome, Mayor Leon.
Bienvenido. Sorry, man, I was starving. I'm eating some good Chinese food here in Huron, California. Not only do we have the best tacos west of the Mississippi, we got some great Chinese food. Well, saludos a todos. Good afternoon. And thank you for the introduction. And just a little update. The LEAP Institute is a 501c3. I think we've gone into the second year now. So we're really happy about that. And also, I'm the mayor, but my father arrived in 1951 as an orphan from Michoacan, an undocumented farm worker, and we've been here ever since. Excuse me. So this is my neighborhood. These are my stomping grounds. I went from here to UC Berkeley. So go Bears. For those that didn't notice the hat. But in 1994, I came back home one summer and was bored to death and went to the clinic where the current mayor at the time was also the director of the health center. And I asked him, hey, I'm really bored. Would like to help you guys out, volunteer, whatever. So he was able to call. He called immediately the CEO. They set up a meeting, and they had me do my first participatory action research project. I engaged over 100 farm worker families, surveyed them to find out the needs in the community, what was good, what was bad, what was missing. And so I implemented that. They gave me a huge stipend, I thought, at the time, $2,000. It was like huge for me. It was a lot of money for me back in those days. Still is today, as a matter of fact. But after I did that, I was really impressed because of the fact that these elder Chicanos at the time, at my age, I considered them such. These older Chicanos were taking me under the wing and mentoring me and providing me this huge opportunity and paying me, So it was a beautiful intergenerational responsibility, strong act of responsibility. And so after that happened, they approached me and said, hey, Ray, we haven't had a health fair in 7 years. Do you want to organize it? But we don't have no more money. I said, no problem. So long story short, that initiated my my intense interest in the public health of my community. Coming from farm worker roots, my dad being a Rattero farm worker as well, and growing up in Huron, it's always been something strong and close to my heart. Every summer I'd come back home, organize a health fair as a volunteer. Nobody paid any money, nobody got paid any money, but it happened, and each year we would engage at least 200 families. And many times families would come in as far as Madera County, because I would hit all the media streams, including the Radio Bilingüe, which on Sundays, it's a Mixteco program. So it was a cool little gem in the farm worker community, very much geographically isolated on the west side of Fresno County, near the 5. But anyhow, so long story short, I come back home and, you know, I've been out here organizing, been doing environmental justice, air quality policy for the past numerous years. One of the projects that we created under the LEAP Institute, LEAP standing for Latino Equity, Advocacy, and Policy, is called Reiteros, which is essentially a rural ride-sharing program utilizing electric vehicles, because the San Joaquin Valley is one of the most contaminated air basins in the nation, #1. It's also a region that has been suffering from a great deal of economic injustices, lack of access to quality education, and illness, and of course, numerous sources of pollution, including pesticides and many others. And so we're at the, you know, bottom of the barrel, you know, and over and over again, one thing that we recognize and we realize and we continue to fight for is the improvement and the advancement of our infrastructure, right? And so, so part of that infrastructure regards transportation. You know, in our community, if you want to go to Fresno to the doctor's appointment, you got to get a bus, and it's going to be a round trip of about 7 hours, right? With a pocket of about 3 hours in the city, and then you got to figure out how to get to where you got to get to. So, you know, being a child, when one of my cousins was passing away, everybody got the Raiteros. Raiteros is a bilingual word, Spanglish term, meaning those that give rides or take rides, right? Raite, give me a ride, give me a ride. And so, so all the Raiteros were gone that day, so we had to take the bus, and that was my experience, you know. And pretty much after that, as a environmental justice activist, advocate, and leader, started working to try to change that and many other things. So today with the GreenRights is basically the Raiteros program continuing formally with dispatch, with electric vehicles, with 10 electric vehicle chargers at the headquarters in Huron. And we provide rides to farm worker families directly, door to door, to their doctor's appointments in Hanford, in Selma, Fresno, Bakersfield, you know, and from small towns to small towns as well for dialysis, a lot of dialysis patients. So as you may have already gathered from the previous presenters, our region is very vulnerable, extremely vulnerable. And with all of these cumulative health impacts already existing, then you add to that the smoke from all the fires. You know, we are a bowl. So whatever fires are happening, whatever side of this bowl, it all comes into our area. And it just makes the situation worse. Not to mention COVID-19, right, which is the topic of today's session. It makes it that much worse. You know, as mayor, let me share, we're one of the first cities, I think probably even the first city in March. I always try to think out of the bread, you know, out of the bun, you know, and out of the box. And so I was already telling my city manager, hey man, I want to build a hand washing station. And he said, no, we don't got to build it. I could rent some. I said, oh, fabulous. Let's rent some. So I think we're the first community with a bunch of mobile hand washing stations for our farm workers, migrant farm workers and our residents, because at the time also, especially small businesses were not allowing people to use their restrooms. So just, it's kind of been on the fly. You know, this is the first time it's happened to us, and all of us, you know, here in the States, it seems like other parts of the world have dealt with, you know, Ebola and other stuff, but yeah, it's just terrible that we have to deal with this, especially in an area where we are extremely vulnerable, where farm workers have never been really valued to the extent that they should be valued. You know, Huron is a hardcore farm worker community. We've been the melon capital of the world. We've been the cotton capital of the world. We've been the one of the part of the lettuce industry capitals of the world, of the trio. And yet our poverty is still high, even when we are in a county that has been recognized with having the highest ag revenue in the country, which may very well mean the world. So, you know, it's a uphill struggle. But we're doing everything we can to try to bridge the gaps, to try to, you know, provide the tools so that we could make a change. Reiteros is but a piece, and that's part of the nonprofit. As a mayor, doing everything we can over here. And again, you know, let me go back to infrastructure. You know, there's no public restrooms in the community of Huron. You know, these type of communities that are farm worker communities, that are essential communities, should have outdoor facilities. And so that was one of the propositions that I shared with the county, and so that we could have a facility that's got not just a restroom, but a shower, you know, self-cleansing, outdoor hydration stations. In the heat during the summer, it's terrible, you know, and so you don't have to buy a bottled water that's expensive. You can have your container, you can refill it, hand washing stations on the outside, have some Wi-Fi, some monitors, some ongoing commercials about public health awareness in Spanish and English, and maybe one of the 9 indigenous languages that we have spoken in the community of Huron. We're extremely diverse. We're like a Mesoamerican village in California. And so the sensitivity to all of our populations, that some people would say, oh, that's the Latino community. No, it's way more complex than to say it's just a Latino, Latinx, whatever, right? So we're made up of, to a great extent, indigenous peoples from Mesoamerica, my family included, with the Purepecha roots. So that's been the struggle lately. Fortunately, we got a big donation from the Ag Commissioner of tens of thousands of masks. We still got to pick up more of them, and sanitizers. So we've been doing the duty of going to the other communities that on the west side of Fresno County, San Joaquin, Mendota, Fireball, you know, those that are other Hurons, I would like to say, are very similar to us. You know, we're at close to 100% Latino population, you know, and I've been dropping off boxes of 1,000 masks in each community. I'm gonna do another round this week. And I'm telling people, joking around, that they're gonna end up calling me Mil Máscaras, you know, the Mexican wrestler whose name is Mil Máscaras, 1,000 masks. But, you know, we really got to get that out there, and it's got to be common so that people could feel comfortable and not think that they're being oddball. So when more people have masks on, you know, it's that's prevention straight up. Sanitizer, you know, in each vehicle of the farm workers that are carpooling or van pulling, that's critical. You know, I hear that they're trying to blame farm workers for their gatherings or what have you, but that's just hogwash. You know, it's at the end of the day, it's about the employer really taking responsibility. And it's a disaster what happened at the poultry shop up north from here as well. And so all of us, we got to do our part. You know, you never step back and put your hands in your pocket and drag your feet, assuming somebody else is going to do it. You got to be proactive. And when you implement a solution, it should solve more than at least 3 problems. So that's what I got.
Thank you, Mayor. You are so inspiring, and I love your energy. We have a couple of minutes left, so I would like to be able to ask a question to Dr. Werner. So Tanya, your research and work focuses on how policies and exceptions to policies shape health outcomes. How does the COVID-19 Equity Project afford everyone, especially communities often overlooked by health policies, the level of testing, support, and services needed to combat the COVID-19 epidemic?
Well, I can tell you that one of the major things that we are doing is partnering with health providers that make it very clear that they will not be charging anyone for taking a test. And so that for me is really crucial. And actually, in our advocacy efforts with the county, they actually have entered into agreements with federally qualified health clinics to also provide grants so that no one will be charged for a test. And so that's like the number one thing is that, you know, because in healthcare, right, we are all way too used to those hidden costs. So we thought, let's remove that barrier first. And then the next thing is really doing an analysis and working with the available data, not just the public health department available data, but with the intelligence that is from the ground about where things are happening, where people are really seeing whether it's at a workplace or at a particular neighborhood, it's so important for us to get that information from our community leaders and then coordinate with our health partners to get a mobile testing site where that is happening. Or if not a mobile testing site, to get our environmental health officers out there inspecting facilities and talking with those employers and providing that health education to those workers as well. So all of that is really, we need partnerships throughout, and but really making sure that those will be trusted partners and that we have expectations laid out about what the community expects from us is important in order to maintain that trust from community.
Thank you very much. How about one more question, if you don't mind? How can other rural communities afford everyone the level of protection and services similar to the Fresno COVID-19 Equity Project?
So this is something that's really, really exciting. We've been talking a lot with our partners at the state level to really say, hey, you know, our plan, we have laid it out for you. We want other counties to take it up. And so right now, I know that there are several counties in talks about doing a similar COVID-19 equity project. I can tell you that at the core, one of the things that's going to happen is for those in like the public serving, like county governments, city governments, to be able to just think completely outside the paradigm of what they usually do, from like who has access to your data to like what, you know, what is, you have to rethink what is possible to know that community can be a helper. And you can provide all of the safeguards for data, you can provide all of those things, but you will need to take that leap of trying to do things completely different than you have before. And on the community side, it's important to know that that your community may have gotten CARES Act funding to address this pandemic, and it is, you know, upon all of us to make sure those funds are really spent where they are most needed in a strategy that works for your community.